So how much ever safety we've taken care, also we have no clue how we all have been affected with COVID, right? So that is why it's very much important how we need to improve on
Recording in progress.
the post recovery stage, how we need to take care on it. Okay, so before I could speak directly on the lifestyle and nutritional changes, a slight introduction on what exactly is coronavirus, what COVID-19 is. Yes, we've been doing a lot of sessions, but a quick basic information. Okay, so as told, it this disease has affected a lot of individuals, in directly, maybe through contracting the virus, or maybe even through indirectly from any physical inactivities also, right? So firstly we have to understand what exactly is COVID-19. But before that, very very important is, before, during, or after the COVID, eating right and having the right kind of lifestyle is definitely the best tool to overcome any kind of infection, that can be even COVID. Okay, so what exactly is COVID-19? Is, as told you, this is an infectious disease, okay, affecting most of the people, be it any gender. Now, so it's even like affecting young, old, different gender, anybody, right? So some people do have very slight symptoms and few do have very major ones. Okay, so depending upon how the immunity levels are, or how the immune systems are, how strong it is, depending upon that, the severity and intensity of the or the power of this virus is getting attacked to more, right? So how does this happen? As we all know, we've been listening to this news and everything. It spreads through droplets of saliva, or even discharge from the nose when an infected person, coughs or sneezes. And this is the main thing how the virus is spread, right? And it mainly attacks and it spreads through your nose, your eyes, your mouth, and it affects the lungs to the maximum, right? And what are the major symptoms that you see? Firstly, when you get very few, as I told you, few people do not have symptoms at all, and few do have symptoms, depending upon the immunity strength. Okay, so what are the few symptoms that you can see if you are attacked with this viruses? Definitely your congestion, or maybe running nose. You can have some low grade fever, or maybe high fever or chills, headache, fatigue, diarrhea. You have loss of smell and taste. You have dry cough, or even cough which is giving you phlegm formation. And sometimes you do have shortness of breath. You're not able to, when you breathe also, that satisfaction of that complete breathing capacity is lacking. So that is seen. A lot of muscle pains are seen, joint pains are seen. For few, you tend to see a lot of redness of the eyes. Okay, a lot of eye burning sensation is seen. So these are few of the symptoms if you are contracted with a disease. So it's not like everybody has a disease. Person to person it differs also, and for few, you do not see any symptoms as well. Okay, so this is a information on what exactly is COVID-19 that all of us know. Right now, this COVID-19, it's just not the lungs it gets affected to, but yes, it gets affected to different parts of the body also, as I told you. But lung being a very primary target, it even attacks different parts of the body, and that is the reason you tend to see so many symptoms from head to toe. For few people, you tend to see even some skin rashes, some skin allergy also happening. Okay, for few, you tend to see even, as I told you, diarrhea. Some people have urinary tract infections. So it's attacking not only just the lung, but it's affecting the whole area. But why exactly is it affecting? As we've heard in a lot of sessions, we know how it affects. So when the coronavirus attacks, the inflammation happens where your blood vessels tend to, swell up. And you've been listening to this the word called cytokine, right? So this cytokine level shoots up on the higher side, where the severity of the symptoms go more higher and higher. Okay, now how does it affect the different parts of the organs? Is, as we all know, the ACE2 receptors, when it gets blocked, okay, the exchange of the gases, that is your oxygen and carbon dioxide, lacks a lot, because automatically you're not able to breathe well. So the oxygen coming in and the carbon dioxide going out, that is definitely getting reduced. So when this happens on a longer run, the lungs tend to, get filled with the fluids. Okay. So when the fluid keeps on increasing on the lungs, and what happens is the oxygen level carrying to the blood again goes on the very lesser side. So due to this reason, the other organs are also affected, because as told, different organs also need oxygen to have their vital functions or to do their vital functions. So this is the main reason where coronavirus is attacking the other organs, because oxygen is completely lacking. And due to that, few people have seen a lot of suddenly their sugar levels rising, or maybe their digestion completely going haywire, or they see that their mood swings are very high, they completely are confused, their concentration levels are low, and their immunity is dropping down. All this is because oxygen is completely lacking, and the carbon dioxide and oxygen exchange is also completely lacking. Okay. So this is definitely one of the main reason where COVID is not attacking only the lungs, but the other organs as well. Right? Now, as we now understood what happens during, so the recovery stages. So once you've been recovered, okay, you've been taking care, you've been eating good food, you've been on your medications, you've done all the 14 days of being quarantined, isolation, everything. But sometimes what happens, there are, once you are back out of maybe hospitalization, or even you have been slightly recovered from the COVID-19 and you tested negative, there are few people who still have this persistent symptoms during the recovery period also. Few people, yes, they have recovered completely, they do not have any kind of symptoms, but few possible symptoms are seen post recovery also. Now what are those? First thing is definitely your low energy levels. So most of them have complained on this, that they do not have so much of energy as they used to. uh, you know um, they're completely fatigued, right? So that is one thing. Secondly, difficulty in breathing, congestion, cough. So for few people, maybe this is not, because usually 14 days is the time where the virus can spread and it's contagious. But after that, yes, it's not as infectious. But post that also, few people tend to see, nasal congestion happening, cough happening. So these few symptoms are persistent. Loss of smell, taste, and appetite is seen, and then insomnia, anxiety, lack of concentration is seen, headaches are there, and as I told you, all of this is happening maybe due to the severity or the intensity of how much the coronavirus has attacked your lung. Okay, so first thing is, as told, few symptoms will get better on their own, others will require some patience and efforts from your part as well. So it's just not okay 14 days if you have taken the medication and you're out of it. For few people, the symptoms might go a little more higher, or because of the severity of what you have faced. Okay. Now, taking you further, what are the complications more than the simple symptoms that we see? What are the other complications? So over here, if you see, in your first 2 to 3 weeks, your symptoms are quite on the higher side. So that can be all the symptoms, as I told you, your fatigue, your insomniatic conditions, your chest pain, or palpitations, it can be anxiety, depression, any neurological problem, your cough, all of that is to the peak, like in your first 2 to 3 weeks. Post that, it tends to drop down, and for few, it comes down. And for few, it can even go up to even 3 months to 6 months. Okay. So, as told, hair loss is also one of the main, a symptom that is seen post recovery for many of them. The reason is all because of your during your COVID, there's a lot of hepatite which is dropping down, your nutrients are not getting absorbed, blood circulation is lacking, there's no proper exercise, oxygen levels are dropping down, right? So there are so many reasons that the complete nutrients have not been absorbed to the body, which is leading to such conditions, right? And for few people, it has even led to a lot of major conditions where lung fibrosis has happened, a great impact on kidneys has happened, cardiac complications have started, and definitely even the new thing that the researchers have found is definitely the black fungus, which is your mucormycosis. So all of these have given a major complication. So these are like few that I have told. For few, it has even reached to even a major complication. Okay. So as we all know about these things, I'll just give a little understanding on what exactly is mucormycosis also, because we are touching on that point. So, anyhow, it is quite away from the topic, but just a little understanding on what exactly that is. Okay. So, as we all know, that is known as black fungus, right? It is caused by infections or slight molds, actually, which is found in soil, plants, and even decaying organic matter. Okay. So, who's at risk for, especially who's at risk for the black funguses? For people who are having uncontrolled diabetes, who were more on steroids during the COVID period, and who were more into the ICU stage, even having an invasive oxygen therapy. So these people are at higher risk to get this black fungus. And what are the main symptoms? It's almost similar to COVID only, where headaches are more, nasal congestion is there, and mostly you see a little difference on the facial. So the face. So you see a lot of facial deformity. You tend to see swelling on one side of the face, a lot of dental complications, and very importantly is you tend to see a lot of black rust around your nose, your interior of your mouth. All of these are main symptoms of black fungus. Okay. And what is the main prevention is, as told, as much as possible, make sure to maintain your sugar values. Okay. Your sugar values has to be controlled. Make sure your weight is under control, and stay away from humid and unhygienic environment, or anything that way. And very importantly, once you have got COVID and the recovery stage, make sure to change your toothbrush. Okay. And because that's again a very important thing, so that the infection is not again continuing. So make sure you change that. And then all post your COVID also, your complete, be it your towels, your blankets, everything has to be sanitized. So make sure that the hygiene levels of the environment are quite clean, so that the reinfection doesn't happen. So the complications or the intensity or severity of the symptoms are also not prolonging as it used to be. Okay. So that has to be taken care. Now, taking you further, what are the important tests to be taken? Now, if I have to talk to you about, uh, this is the test where you can take to just to have a check on whether everything is under control. Okay. So it's not like, okay, everybody should and must take it. If you feel that, okay, your symptoms are prolonging for a long time and you want to get it checked to see whether your body is in a right condition, whether the severity is on the higher side, is firstly, there's something known as your IgG antibody test, where this exactly evaluates how much antibodies are there in your blood. Okay. So why this is necessary is to see how immune protected you are. So at least for the reinfection, or to understand whether the recovery is happening quick, your body can understand on that. So this test can be done to make sure everything is under control, especially your immunity. Secondly is your complete blood count, because this will assess different types of your blood cells, like your RBCs, the red blood cells, your white blood cells, your platelets. So if this also is under control, it means there's no more infection in the body. So that way you can understand. Third is to understand on your glucose levels, your cholesterol levels, because automatically, as I told you, when you are at a certain types of medications, or when you are in your COVID times, definitely there's a fluctuation of your glucose or your BP levels, and definitely your cholesterol levels also. So it's very much important that your post recovery, that you take care of your lifestyle and maintain on your cholesterol and check on these levels, so that you're not having further complications, like maybe any kind of cardiac problems, or maybe a high sugar levels rising up, where you need to start going on insulin and all of it. Because usually what happens during the corona time, people are more diverted to take only to take care of uh, the virus, the infection, but they would have totally forgot that they have to continue taking their medications for the BP or diabetes as well. So that's very important. So that kind of ignorance can lead to the shooting of the sugar levels as well. And normally, as we've been discussing, corona, the infection, whenever it's on the higher side, inflammation rises high. So vice versa, the glucose levels also may shoot up higher. Okay. And very last is your vitamin D. As we all know, there's a very essential nutrient that helps to improve your immune function. So definitely to have a check on the vitamin D levels are very important, because lesser the vitamin D levels, the recovery doesn't happen quick. Okay, so that can happen even with your stamina, or even with your um, cognition. It can be even with your nervous system. Your complete body is definitely necessary to have the right quantity of vitamin D in your body. So having a check on that, and definitely to check on your oxygen levels also, to make sure that your oxygen levels are on the right side, which is like about 95, which is a very good level of oxygen. Okay. So taking you further, what are the precautions to be taken post recovery also? Okay, so it doesn't mean, okay, once you have got attacked with corona, that you are completely safe and you will not get reinfected. No, chances are very high to get reinfected. Okay, but yes, maybe for a month or two, your immunity is quite high. So people think that you don't get reinfected and there's no point of taking care, or, not wearing a mask. No, it's equally important, because um, taking care of immunity, maintaining immunity is very important. Okay, so absolutely, there are chances the person can get reinfected, and the precautions, as told to, it should be taken care. Okay, like washing your hands, wearing a mask, and being hygienic, having a very good clean environment, social distance, not staying in much of crowded places. Okay, so all of these protocols that we've been looking into and noticing should be continued even after the recovery of COVID. Okay, it's just not during the COVID or before. A person is already infected and he's out of it, should be still continuing such precautions, right? Now, taking you further, like as told, there are few symptoms that is persisting for few people, especially fatigue and tiredness. So, as told, firstly, your tiredness and your energy dropping down. How do we like improvise it? How do we tackle it? Is as told, because why does this happen is, firstly, whenever you are at rest and your eating habits, lack of oxygen, lack of sleep is definitely going to give you such kind of problems, which is tiredness. So even if you have a normal fever also, when you're out of it, the next 2 to 3 days you're not completely energized. You take some time for the body to recover. But coronavirus is much more dangerous than the normal flus that we get. So how do we improvise on tackling the fatigue is definitely, is firstly, physically, mentally, you should be positive minded, keep some tasks for you, take regular breaks. So doesn't mean that once you start it, you have to finish it at once. Take some breaks. So be it even a very normal housework, or maybe even, the normal work that you're doing, your office work, anything also, a person once recovered from COVID is very difficult, because its concentration levels are also lacking. So make sure to take breaks physically and mentally. So only then it will slightly restore your mind, your body as well, to do much more better work for the next session. Okay. And then with that, take some breaks. During the week also, taken off. Like rather than opting doing at once work all the 7 days, take a day off, making sure that you do some stress relief therapies, or take some time for yourself, do some breathing practices. All of this will actually improvise on taking care on your tiredness and fatigue as well. And with that, plan your schedule. Okay, so rather than waking up and having a complete erratic schedule, when you plan your schedule, at least your mind is free, right? So make sure that you have a schedule, what to work, like how to work, the timings that you want to, the work periods, the sleep period, the sleep timing, all of that. Tend to plan a schedule, because that actually helps a lot. to improvise and energize your body as well. Okay. Now, taking you to the next one is how do we tackle on emotional stress? So, as told, definitely during the COVID, during the COVID times, many of them would have experienced a lot of changes in their thinking, or the way of their emotional well-being is completely gone haywire. The reason is firstly because of a lot of negative news that's happening, or worried about family, or maybe financial stress is there, or the fear of whether others will get infected inside the family, or knowing, many of them losing the loved ones, or so many people. So all of this is a completely a negative impact on the person, which creates a lot of fear and anxiety, right? So this can prolong a post COVID um, recovery times as well. So this is very important, because until and unless you're mentally stable, how much ever physical work you're doing also, there's no much of a great output or a result, right? So firstly, you have to understand, to tackle your emotional stress. So firstly is definitely relieve your hobbies. So whatever hobbies or passion you have, it can be very simple, it can be maybe just a drawing or coloring also, but tend to start doing something to divert your mind, because that gives you happiness. So for few people it can be gardening, right? For few people it can be, as I told you, a lot of aromatherapies can be done. So start doing something that you like, right? So that is one thing. Secondly, have good amount of rest, because if you're completely not having good rest, also your brain is under a lot of anxiety, which is leading to again insomniatic issues, where you're not energized properly, your hormones are getting imbalanced. Make sure to have a proper rest, and keep a timing of your rest period also. Let it not be erratic. Okay. Have a good healthy diet, do light exercises. Okay. Do not hide your illness. So share your feelings and emotions to people around you, and share your positive stories also to people around you, and get some positive feedback also, because sharing actually helps to relieve a lot of stress and anxiety and the fear. So make sure, I'm sure that it can be any of your friends or family or anybody in the team. Tend to share your feelings and have some positive thoughts, and continue taking some positive affirmations every day, because all this will give you that positive attitude to get you out of that fear that you were having, through the COVID times. So that is again a very important thing. And definitely altogether tend to regain your strength. Okay. So as told, due to a lot of damage caused by the virus inside the body takes some time to recover completely to get back to your former state. That is very much normal. But how you need to gain back is very, very that much important as well. So, firstly, is tend to reorganize your things, and prioritize your activities, take plenty of rest in between your work, as told. And with this, uh, stay active the whole day. Okay. So rather than being like completely thinking that okay, I've done my 20 minutes of exercise in the morning, doesn't mean that you can be inactive the whole day. So don't be that sedentary, stay active. And very importantly, you have to increase your level of independence, because usually after the 14 days of quarantine or 20 days of quarantine, people tend to become very dependent on others. Now just go, rather than having your food in the bedroom, have it in the kitchen, maybe have it in the dining area. Increase the level of independence as much as possible, rather than asking somebody else for water. You get up, take a glass of water by yourself, do things by yourself. Okay. So stay active, and as told, increase the level of independence as much as possible, because that itself is going to give you a lot of strength, inwardly as well as mentally. Okay. Now, taking you further, very, very important as the topic was nutrition. So, maintaining a healthy diet. Okay, so as told, a very good nutrition is very important before, during, and definitely after an infection also. So, maintaining a healthy diet is the important part of supporting your immune system, because maximizing, so whatever food you're preparing, it has to be high amount of proteins, your vitamins and minerals, your antioxidants, as we've been talking about. Okay. So being in this thing, most of the sessions we know what to eat, what not to eat. So I won't be talking much, but yes, the important uh, tips or important points that we need to notice is that you have to improvise on these kind of foods that we can see. Firstly is your protective foods. So what are your protective foods? Is the foods that is rich on antioxidants, like having a lot of vitamins and minerals. Okay, so that can be a rich source of vitamin A, E, C, zinc, calcium, copper, iron, because all of this is going to improvise on your immunity, not only for a day, but it helps to maintain it also, because more of the antioxidants, it's going to support on fighting any kind of infection. It's just not COVID, but it's like good to support on your immune system to fight against any kind of infection even in the future. And by chance, if the inflammation in the body is still there due to your cytokine levels going on the higher side, taking good amount of protective foods will help you to reduce the inflammation in the body. Okay. And secondly is energy rich food. So most of us miss out this. So we all know that we have to have a good vitamin mineral rich food and a protein rich food, but for a post recovery person, it is very important to equally have a good amount of calorie based food. I know for few people, weight loss has been their first priority. But if by chance the severity of COVID was there and you have such symptoms which is prolonging, let your first priority be recovery of your body, and then you can look for the second priority being weight loss, because only then you will see great results on it. Okay, so again, energy rich foods doesn't mean that you can opt for um, high calorie or empty calorie foods. Cereals also that you choose should be a healthy form. Okay, so that again, as told, it should be your wheat, your it can be your maize, your rice. All of this can be used as much as possible. Okay, but make sure that you're not going low on calorie, because already your body is tired and it requires carbohydrates to support and boost the energy. Okay, so definitely make sure your whole grains, your avocados, your as I told, your channa, all of this can be used in a regular way to support on a healthy diet. Okay, but again, make sure the quantity is also taken care. So how do we take control of the quantity? Is dividing your meals. Okay, so rather than having whole meals at once, divide it to 5 to 6 so that you're having smaller quantity. But don't go low on calorie if you are a post recovered patient of COVID. Okay, so do not go zero on calorie or do not go low on calorie. You definitely require good amount of carbohydrates. With that, your bodybuilding foods, which is again your protein rich foods, to repair your body's tissues, and by chance the muscle loss that has happened, to support on that, and the medications that you've been taking, the high dose of medications which is leading to hair fall, tiredness, and all of that, protein rich foods are going to be a great support. Usually we give only 1 gram per kg body weight, but during the recovery stage we give up to 1.3 to 1.5 the amount of proteins which is required to the body. Okay, with that, definitely your immunity boosters to be continued, because immunity doesn't mean only for a certain period of time. You have to maintain it for a longer run as well. Okay, so herbal teas, your ginger, your garlic, all your spices and herbs that we're talking about, you can continue taking care on that. With that, as told, the whole thing in one. Make sure you plan, you adjust your portion size, try avoiding all the junk, sugary foods, high amount of salt foods, and increase your fruits and vegetables. The servings can go up to even 4 to 5 servings per day. Reduce much of your sodas. Instead, go for hydration, because water actually improvises